We are continuing with our A to Z for anything segments, right? And today is the letter U. Dr. Brett Doxey joining us from Utah Gastroenterology. And U is for ulcers, which you may not be happy that you have. If you do have one, how do you get those and how do you know?
Well, ulcers are incredibly common. As many as 1 in 10 people are going to suffer from a significant ulcer at some point in their life.
1 in 10?
1 in 10.
Wow.
There's many different causes. Essentially what an ulcer is it's a sore located in the stomach or intestine. If you think about it, your stomach is constantly bathed in acids and things that are helping you digest food, and it manages to do that without injuring itself most of the time. However, if it loses the ability to protect itself, you can get these sores that can cause horrible complications.
But, sorry, just what are the symptoms? How do you know you're getting one or got one? That's the difference.
So symptoms are very variable. Some of the most common symptoms people complain of is pain in the upper portion of the stomach, located anywhere from the belly button up to the breastbone. People can complain of gnawing, burning, aching discomfort.
Okay.
Some things that people will commonly tell us is that it may get worse with eating, or it may get worse with fasting while your stomach's empty and subjected to the stomach acids.
Once you have one, is it permanent or can you get rid of it?
Absolutely not. Ulcers are treatable depending on what caused them.
Okay, so how do you treat those?
Well, ulcers, as I mentioned, there's several different causes. The two most common causes of ulcers are actually a bacteria called H. pylori.
Okay.
And secondly, pain medicines.
Really?
Ibuprofen, Motrin, Aleve, these medicines that we call non-steroidal anti-inflammatories that so many of us use on a daily basis actually are responsible for as many as 100,000 hospitalizations every year for gastrointestinal problems and ulcers.
Okay, so you mentioned H. pylori. What is that? H.
pylori is a bacteria that was discovered in the 80s.
Okay.
A few decades ago, if you would have asked the doctor, where did this ulcer come from, they would have said it's caused by stress, take some acids,
That's what I've heard. It's
get
stress.
some rest. Stress can contribute to a lot of intestinal symptoms, but it doesn't cause ulcers. What we later found out is the majority of these were caused by this bacteria. It's common. Almost half the world will get infected with it at some point in their life. Most people never even know they have it, but if you do have it, you have about a 1 in 5 chance during your life of getting a significant ulcer.
So someone comes in, you sit them down, and you say, all right, let's figure out the cause, and then you talk treatment?
Absolutely. So first thing is we diagnose. Talk to your doctor if you have any concerning symptoms. Pain, discomfort,
constant
weight
pain
loss.
Or here and there?
It's most commonly kind of comes and goes. Another interesting thing, the pain will sometimes wake you up at night. We have a lot of acid produced at night. And there's a couple serious symptoms that patients should be aware of. Evidence of bleeding, vomiting of blood, passing dark stools. Dark stools is actually a sign of blood loss, that blood has been acted on in the intestine.
I wanted to ask you, a lot of people's, there's that joke out there, oh, I'm so stressed I'm going to get an ulcer. Does worry and stress and fatigue and all those things create an ulcer, or is it just the same?
Stress can be a contributing factor, but by itself, the day-to-day stress that we all deal with won't do it. There's got to be something else there, and that's where this bacteria or pain medicines like ibuprofen, Motrin, Aleve really come into play.
Most common treatment would be what?
Most common treatment is actually, well, given that the most common cause is these bacteria, we got to find it and then treat it with antibiotics. Treatment also consists of using other medicines that reduce stomach acid and promote healing.
1 in 10 people will have an ulcer at some point in their life. So you will need the number to Utah Gastroenterology. We're going to put their information on our website, make it easy to link you to theirs. Go to abc4.com/dailydish, and all the information is right there. You can ask for Dr. Brett Doxey or any of the doctors there too. Thank you so much
for the
information.